The reason that I found Dr. Whittle, I actually happened to be at home one afternoon, didn't have to go into work, and saw a commercial on TV that advertised a free screening. I had been concerned for some time about a condition that had occurred after pregnancy, or during pregnancy, and then after pregnancy with my leg, swelling and some pain with my leg. And so I thought, I had not previously gotten a diagnosis that I was pleased with my primary care physician. So I said, maybe this would be a good opportunity to go get something else investigated. So I called and made an appointment for a free screening and came in, participated in the free screening. And in fact, they found that I had a previous blood clot. So they figured out, yes, there was in fact something wrong with me, but I was not imagining it. They then scheduled me for a follow-up appointment that involved additional ultrasounds to my legs, a couple different procedures, which was certainly not a big deal. And then ended up scheduling me for a venogram and with the possibility they had mentioned of putting stents in to my veins to help with my leg swelling. The procedure was great. They were very, I think Dr. Whittle and all of his staff, nurses, his PA, everyone that I've worked with here have been very positive, very supportive. They've answered all of my questions. They have done a great job of making me feel like I'm in control of the procedures and the things that are taking place. They have provided me with adequate information and kind of walked me through the whole process step by step. So when by the time I got to the hospital, I knew exactly what the procedure would be, what would take place. So I didn't have any questions. They were great in the follow-up care. By the time I came back for my follow-up visit, everything, the problem that I had originally had with leg swelling and everything had gone down. So the outcome was the desired outcome. So I'm really glad that I did come. Well, I do just want to say that I like the fact that this is a Christian atmosphere. You can tell that people are very caring and supportive, and they truly want what's best for their patients. And you get that impression the first time that you walk in, from the very first screening. People seem to care about you and to care about your well-being. They were grateful for the fact that I had found them, and I felt the same way. I think he is very patient. He does a great job of asking questions and of answering all of the questions that I had, that my husband had, both before and after the procedure. So you just really, coming here, you really feel like someone cares about your well-being and cares about you as a patient.